South Korea is working to achieve herd immunity from COVID-19 by November. Next up for vaccination are seniors older than 75 among the general public, but doses could be delayed due to global shortage. Kim Do-yeon explains further.
South Korea's plan to achieve herd immunity by November is under threat as the country's planned supplies are now in question due to the global shortage of vaccines. The first noticeable result from the shortage comes from COVAX's AstraZeneca jabs. 690,000 doses were supposed to leave the Netherlands on the 30th of March for South Korea, but have been delayed until the third week of April, and the amount has now been reduced to 432,000 doses. This also puts in question the original 1.4 million doses that were supposed to be shipped for Korea starting April 22nd.
Despite the current vaccine supply situation, we can't delay achieving herd immunity any longer in order to get out of the COVID-19 situation. So, in order to achieve the original goal without delay, the government is making efforts to secure the vaccine, and it is putting together all its capabilities to ensure that the planned inoculation plan is carried out according to the original goal.
The authorities have decided to use the supply for second shots to increase the number of first shots instead. Next up in April are people over 75. As of Tuesday, 820,000 received their first shots. South Korea's turbulent vaccine supply situation comes from global vaccine exporters shutting their doors. The U.S. developer Johnson & Johnson has said its supply for South Korea will be cut down to doses to less than 500,000 people as the U.S. tries to ramp up its inoculation drive and President Biden pushes to inoculate 200 million people by April. The European Union was actually expecting 120 million doses of AstraZeneca, but so far has only received 30 million of those and has decided to curb its exports to other countries to keep the supply within the region for its own use.
We will make sure that everything stays in Europe until the company will come back to its commitment. And this is why we have this instrument that the President of the Commission yesterday again put in place to make sure that we control and we don't have any leakage, if I may say so.
In addition to control the domestic COVID-19 cases, India has also banned exports of vaccines. Its producer, Serum Institute, is contracted to provide 550 million doses of AstraZeneca shots to the COVAX facility, but reports suggest the export ban will last for a couple of months. Kim Do-yeon, Arirang News.